How often should I visit the dentist? Well, that really is patient dependent. So for example, in the case of children who are constantly growing and undergoing changes, their jawbones are growing, they're going through that transition period from baby teeth to mixed dentition, adult dentition may need to be seen every 6 monthly and may need orthodontic treatment. For adults who have a lot of restorations, crowns, fillings, nothing lasts forever. Everything has an expiry date, and around the fillings there may be leakage, so therefore these need to be checked a little bit more often, and maybe every 3 months or every 6 months. And for those adults who have absolutely no problem at all, as deemed by the dentist, so they've had a check and there's no restorations, gums are healthy, may be seen perhaps every year or once every 2 years. How often should I have my teeth professionally cleaned? That again is patient dependent. The dentist and hygienist will check, and if you have an underlying gum issue, then you maybe need to be seen perhaps monthly or every 3 months, and if there's nothing wrong, then it may be once a year. I like this question which somebody asked me, and it was, Dr. Hale, how do I actually self-check my own teeth at home? That's a really good question. For example, if you have bleeding gums whilst you're brushing your teeth, then that may be an underlying gum disease, and don't stop brushing, don't be put off, but do take your brush with you and interdental brushes or whatever you use. Go and show the hygienist and dentist what you do, because they can improve your technique, and that may be a sign of underlying gum disease, so they can address that with lots of gum cleaning professionally. Or bad breath. So for example, if you've got cavities inside your teeth, that may be a food trap. Or if you've got crooked teeth or spacing between the teeth, again, food may get trapped and be difficult to clean and cause you bad breath. Or there may be underlying gastrointestinal problems. Or for example, you're smoking, or certain foods can actually cause bad breath. So that would be a good idea to get that checked as well. Also, sensitivity to hot and cold drinks may be a sign of decay starting within your teeth. And if you're clenching or grinding at night, then you would be wearing down the enamel, so that would be a good idea to go and get that checked and monitored, especially in kids during exam times, or right now where we're all working from home and constantly on the computer, really stiff, sort of clenching without realizing. We can easily make you a splint or a mouth guard to protect your teeth. And finally, when do I floss my teeth, or how do I floss my teeth? Flossing, you need to be really careful what technique you use, because you don't want to use it like a hacksaw that damages your gums. So make sure you show your hygienist what you do. And I quite like these interdental brushes, and you can find the size that actually works for you. That's also good for orthodontic braces, because it can easily get underneath the wire and clear out all the food debris that gets caught inside the brace. So those are pretty good, and you should floss or use the interdental brush before you're actually brushing your teeth, and then spit out the fluoride toothpaste. Don't rinse, because you want some fluoride to sort of linger onto the teeth and help promote fluoride inside the tooth and strengthen the teeth. And also use a mouthwash, and a mouthwash can be used at a different time to brushing, so that you're constantly giving your teeth fluoride. And clearly stay with a very healthy, balanced diet. So I hope all that helps. Thank you.